October is Domestic Violence Awareness Month. We'll discuss what impact COVID-19 has had and the future of domestic violence. That's this week on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstat and additional supporting sponsors.
Nevada has one of the highest domestic violence rates in the country. Since COVID-19 began, the issue has escalated. Not only are local agencies seeing an increase in victim advocacy, but there is also a heightened need for housing, abuser intervention, and auxiliary services. On today's Nevada Week, we'll discuss how COVID-19 has affected domestic violence in Nevada, plus the resources available for those in need. Joining us for this discussion is Liz Ortenburger, CEO of Safe Nest and a family member of mine. JHENNA HALILI, victim advocate at the Las Vegas Metropolitan Police Department. And Gabriella Jones, directing attorney at the Family Justice Project at the Legal Aid Center of Southern Nevada. Well, JHENNA, Gabriella, Liz, thank you so much for joining us. Nevada Week has covered domestic violence several times, but never in the crisis that we currently are in with COVID. And I wanted to start right there, Liz. Let's get your perspective. I mean, to the layperson, we're dealing with factors maybe that could be additional stressors all the way through with COVID. And then we're dealing, of course, with closures and quarantine, where we've got family members that are together more so than they maybe typically would. It seems like that's the perfect storm for domestic violence increases, but maybe it's not. Let's get your perspective first. How has this affected domestic violence?
Yes, so you're exactly right. The factors of anytime we have a mass incident or a mass event, we saw this after the 10/1 shooting, we see it after hurricanes, after earthquakes. An entire community is triggered and stressed at the same time. So those that are likely to use violence are more likely to use it during that time period. So you have a concentrated period of abusive behavior. Then you layer on top of that an economic issue, right? So every time we have a recession, we see domestic violence rates go up. Financial stress is one of the leading causes of domestic violence in households where abuse already exists. Then we asked everybody to stay at home together. Then we asked you to teach your kids at home together. Then we asked you to do all of these things in an isolated environment away from your normal stress relieving activities. So there's nowhere for domestic violence to go but up. And we see that in our agency. Our hotline crisis calls are up at a sustained 20% over prior year periods. And our bed count is up 150%. Part of that's because of the increased rate, and part of that is because Safe Nest is the only domestic violence agency that remained open and fully operational during this period. So the numbers are up. The very interesting piece, though, is homicides are down, and that's also related to some programs that we've put into place. So while there's catastrophic things happening, there's also a silver lining in that space.
And we're going to talk about some of those programs in just a sec, but can you give us some context on a normal year? I know the homicides last year were 19. Previous years, what is the average that we see?
So the average we see in Clark County is 24 in a year. That's the 5-year trending average prior to the program that we put in place with Metro.
JHENNA, let's talk more about the victim advocacy side and also just law enforcement in general. Liz mentions that calls to our hotline are up. Are you seeing the same on the victim advocacy side? And do you have any data or any anecdotal evidence of where arrests have been?
Yeah, we definitely see the increase, as Liz said. As far as advocacy, all the advocates in my agency, we haven't really seen a change. We're still working out of the office and still responding out into the field. I think the challenge was to see that a lot of services were either temporarily shut down or they had delay response because a lot of them were working remotely. I do think that, like Liz said, the silver lining was that we made very progressive movements towards developing virtual resources. As far as, for instance, I work at the Family Justice Center. We usually file the protection orders for the victims of domestic violence. We now have a online guided version that we can work with. So instead of coming in person filling out the protection orders, we do see a lot of high volume calls as well as, email, telecommunication, things like that. So I definitely see an increase there as well. As far as with Metro, we do have a text to 911 feature. We know that from experience with victims of domestic violence, they may be in more danger when calling to 911. So now that we have the text to 911 feature, the family staying at home, the phone call may not be ideal. So the texting feature has made that more safer for victims to reach out, whereas calling may not be the best timing as far as staying home.
Gabriella, Jenna's mentioning a lot of virtual pieces to this, of course, at the Legal Aid Center of Southern Nevada, being that you're dealing so much in the Family Justice Project with the court system itself, and courts, for the most part, have been shut down. What kind of impact has that had on your work?
So one of the areas we focused on was the protection order. Our Family Law Self-Help Center immediately implemented procedures to help victims to obtain protection orders. We added forms to the website so that they would be able to fill out for a protection order that way. We had, for people who didn't have computer access, we had our staff assisting those people over the phone so that they could obtain a protection order. As far as the family law piece, the typical custody and divorce, with the courts being closed initially while they were figuring out how they were going to move things, it was slow. And so you had people who had just come to the resolution that they were going to stay in the home and deal with that later. Once the courts began to open up, people became more comfortable with filing, and we started to see an increase in that. And not just in filing for the divorce and custody. We also assist a lot of people. We have a huge undocumented population here, and we assist those individuals also with obtaining immigration status who've been a victim of abuse. So we've seen an increase in that too. So just kind of getting everybody through the system, but just as much online stuff that we can do, that's what we've been doing.
Gabriella, interesting point. Liz, I want to get your perspective on this too. We've heard this in the healthcare side when we've covered this on Nevada Week, that individuals that might have other health concerns stay away from hospitals during COVID. It sounds like that could potentially be the case here too, where because our court systems weren't open, we had victims that maybe weren't reaching out the way that they would before. Do you think that's, for one thing, the reason why you've seen the increase in your hotline, or are you seeing that specifically in the outreach that you've been getting from victims?
So domestic violence is incredibly complicated, and there is a lot of reasons why a victim does not want to intersect with any of our legal or criminal systems, because we are a mandatory arrest state. So calling 911 if there's signs of violence when the police come to the scene means somebody's going to jail. That is a whole layer of complications, right? And as a movement, we don't talk about the intersectionality of domestic violence and poverty enough. But there's a whole host of reasons why victims are hesitant to call. What we find, unrelated to COVID, is that the periods in time in Las Vegas in which windows are open, when we have bystander intervention in domestic violence, is very, very different than the times in the winter and the summer when the windows are closed, and it's beholden on the victim or somebody close to the victim to call 911, somebody inside that household. So I don't know that there's an exact correlation with COVID in that space and people not wanting to reach out. I think it's the layers of complexity with what we deal with every day, and a pandemic's just made everything more difficult.
Liz, you've said on previous shows that domestic violence is not discriminatory based on age or ethnicity or race or socioeconomic status as well, maybe gender, predominantly with women being more victims. Being that we're in this COVID crisis, are you seeing that change at all?
Absolutely. So we've seen a pretty dramatic uptick in the male victims that have been needing our services. But that's been an interesting place for safeness. We've always had male victims, but at the numbers that we're having now, we've had to get creative in how we do our housing program, because our shelter is designed to be a single gender shelter with kids. So that has been an interesting piece in this. But we're also seeing, I think, levels of desperation layered on top of domestic violence in a more dramatic way than we've seen before. So if you're living paycheck to paycheck, and there's an eviction moratorium, and now you're coming to the end of that moratorium as we're deploying CARES Act money, like many of my partner agencies in the community, the level of desperation behind the phone call, that level of desperation, I don't have data on this because none exists, but there's a correlation between the level of desperation and the depth of the violence that we're seeing. So there are correlations in there. They're not always the ones that pop to the surface or would make the most sense to folks that aren't in this every day, but we are seeing a lot more physical and really deep physical violence in this time.
And Jenna, I wanted to get your perspective on this too. Metro and your victim advocacy unit here, are you seeing similar results?
Yes, I think me personally, in the advocacy, I have seen a lot of victims come to me who may have lost their jobs. They may have had the income. They may have had the financial backing to move out of the situation, but because of the COVID situation, they have lost their source of income. And like Liz said, financially, that's a huge burden that wasn't recognized before to them because they had the income. So I've seen a lot more people come forward as far as, I've never had this instance before. I was doing fine with all my financial, I could support myself, support my kids, but I totally lost my job and I'm at a loss. So I think it definitely has impacted economically across the board, especially with those who may be above the poverty level, maybe in middle class. I have seen more victims come from that perspective, needing rental assistance, especially after the moratorium ended. They have no idea where to go next. So that's a huge change I see.
Yeah, and to piggyback on that, what you're seeing too in the space is a victim who wasn't working, but their abusive spouse or partner lost their job, does not have access to those dollars because they're not the primary person who lost their job. So a lot of what we have to advocate and educate around is the idea that this is still a unit, and the unit is suffering. The family unit is suffering. We need to probably separate the family unit, but the person who's not working is the person who's going to be homeless. And there are so many complexities in there. And the national stat, we don't have a local one, is that 50% of women who are homeless because of domestic violence. That is going to escalate during this time period. We are going to see a lot more women, and a lot more women with children that are homeless, because the CARES Act money is in essence cut them out.
Yeah, that's extremely concerning, and really a great segue. We're already talking about it, in transitioning from this COVID crisis to recovery and what that could mean. And experts are saying recovery is going to be multiple years. Liz, you've already talked about how that could potentially affect female victims here. Gabriella, I want to get your perspective on this specifically. Within what the Family Justice Project is doing, are there certain challenges that you foresee as we move into a recovery phase? We've already talked about some of them. Or potentially, do you see new opportunities here to be able to help domestic violence victims in kind of a recovery phase?
I would hope there would be new opportunities to help domestic violence victims. Everything comes down to funding and having those tools available to help people. One of the challenges that I see is that again, my work focuses a lot on undocumented immigrants, and so I still see them being left behind as far as when they already have the language barrier. There's already that distrust. Resources they've been excluded from them. So I see it still being a struggle for those individuals to move past this. What we're seeing is a lot of situations, we're getting calls where people who are in very bad situations, but because they're undocumented, they don't want to leave because they don't know where to go. And for them, the choice is leave my abuser or go out and expose myself and my children to COVID and have no means of providing for them. So it's a sad situation. And we don't know how to tell them to get out of it. It's a personal choice. We can provide the legal means to push them through the system, but they have to be comfortable and know that there's something that they can rely on. So I'd like to see more resources where people are comfortable making those choices.
I want to talk about funding and ask our entire panel here. So much is tied in, of course, to our tax revenue. Tax revenue could affect multiple programs, our nonprofit community-based sector, but also our public sector as well. Jenna, I just wanted to ask you, any of the programs that are running, are they in jeopardy potentially of being reduced with some of the tax reductions that we're seeing in our overall revenue as a state?
I can't speak for all programs. As far as with Metro, with our advocacy in our program, are not doing any reductions. I know in the upcoming year, as far as budgeting, there is going to be some movement and changes. But as far as our team itself, there hasn't been any talk of, going and lowering or reducing anything. As far as other programs, maybe Liz and Gabrielle can speak to that.
Yeah, Liz, I'd like to ask you specifically with the community-based sector and an organization like SafeNest, how is this affecting you or your funding streams?
So the largest funding stream that's affected for us is marriage license. So built into our marriage license fee is a portion of that set aside for sexual assault and domestic violence. SafeNest is the largest provider in the state. That's normally a $1.2 million a year award for us. This year it was $200,000. So $1 million shortfall on a $7 million budget is always concerning. I think this is where nonprofits that have good business practices and have done right in the times when things maybe were a little bit more flush and have reserves and things like that will be able to continue to do the work. We are fortunate to be in that space. But it is a difficult time. There is so much confusion around the PPP loans, which we, of course, used and helped to fill that gap. We also have a large earned revenue arm, which is, concerning because earned revenue is going to be an interesting thing. And how's that going to recover along with the work that we need to be doing? But I'll say one of the things about Las Vegas that is always been different than many of the other places that I've worked is that the community comes together. So really, domestic violence and I think food insecurity have emerged as these two major topics that the community is aware. And we were awarded at the beginning of the pandemic a $500,000 grant from Nevada Women's Philanthropy, which allowed us to expand our Metro program, which ultimately is driving down homicides. So there are really good things happening. I think our state legislators need to understand they are leaving many of us that are doing this hard work and quite frankly filling in gaps that the state can no longer handle. There needs to be an understanding of who the providers are that are strength in that space and what we're doing, and that there needs to be additional pots of money to keep that work going. A homicide costs Metro $9 million a year. We've prevented 8. So we can do the math on how many millions of dollars we're saving the community. I need legislators to understand that and start to figure out how to monetize and reward agencies like mine that are doing this hard work so we can continue to grow in best interest of the victims.
Liz, I wanted to ask you, because we do have a legislative session coming up really in just a few months here, and because we are in this recovery phase and so much of what is discussed in that legislative session could very much be economic recovery, are you afraid that something like domestic violence could just get lost in the fray here?
I'm not, because we're doing all the right work to not let it be left in the fray. I mean, I have a fantastic lobby firm in Strategies 360. We held a legislative breakfast a couple of weeks ago that was well attended. But we do need legislators to understand there's a reality, right? None of us wants homelessness to increase. Well, then let's talk about what the triggers are before homelessness, and domestic violence is one of them.
And we've had some legislation that has passed that maybe could potentially coalesce that. Of course, the main one is that we do have a domestic violence commission now appointed by the Attorney General. Gabrielle, I want to ask you, the legislation that's already passed in previous sessions, do you think we're already seeing signs that maybe it's helping, or do you have a good sense that it is going to improve kind of where we are?
I think there's been some improvement, but there's room for more. One of the things that we were really excited about was to see the TPO could be extended for 2 years as opposed to the 1 year. But now it's the application of that, actually getting the hearing commissioners to do it. Day in and day out, myself and my colleagues go into court on these protection orders, and we're not seeing the 2-year extensions. And we're attorneys, and so imagine a victim going in alone. there's no way he or she is getting that to your extension. So it's nice to have the law, but if we don't have the courts that are implementing it, it does us no good. So I would like to see actually more from legislation, more teeth in domestic violence laws.
Jenna, let's talk specifically about victim advocacy here too. Let's look beyond COVID. We're already talking about this. We're talking about kind of long-term solutions here through your work that you've done. What do you think are some key solutions that are top of mind for you?
Well, actually, I've been working with a couple people from the Rape Crisis Center and also the Child Advocacy Center. We have actually held our first advocate social, which was this past Tuesday. What we're trying to do is get all the advocates together, both community-based and system-based, kind of build stronger relationships with each other. You know, we email all the time, text, communicate, but to actually see a face and match a name, it does make it more personable and gives us a contact at each and every organization. Eventually, what we want to do is start to invite outside organizations that we use as resources for housing, food, clothing, things like that, to come and present at these social. That way we have a better understanding of how the process works, how intakes are. You know, we do not want to send someone over to a place that we don't understand how the process is. You know, they're already stressed out with this situation, to add them going to an unknown place to see if they're going to get approved or denied, or are they taking people in person, or is it telephonically? We kind of want to have more education as far as how the process work. And I think if we bring all advocates together on our end, we want to do this bi-monthly. I think it is a good step towards building relationships among advocates and relationships with the community.
Liz, Jen is saying a lot of additional engagement with the resources in the town. And of course, SafeNest is one of those. I want to talk specifically about PS 417, something that we talked about on a previous show. We really highlighted that multi-agency collaboration. You mentioned at the beginning of the show that it seems to have some indication that that is reducing our homicide rates. Do you see that as being a solution of expanding this program beyond where it is? And give us some status on where that expansion has gone since we last talked to you.
Yes, so the program is now 24/7, 365. So I think when we did the show about a year and a half ago, we were doing 30 calls a week. This month will be over 500 calls a month this month. So we're where that program is perfect. And to speak to Jenna's point, the program is perfect because at the time of crisis for a victim, the world of services is opened up to them. So our advocates go into the scene. We provide confidential support while Metro keeps the scene safe. And then 57% of those victims connect with us for longer services through either our court program, our counseling program, or they come into our shelter program and get into our transitional housing program. So it's incredibly helpful. The thing that always frustrates me as a person who spends money on marketing and PR is that we go to all of these sites and many, many, many victims have no idea that services like SafeNest exist. So this is a way to get that service right in front of the victim. And the program is gaining national attention. And then we've been actually asked now by the State Department to do some international presentations because of the success that we're seeing. And that is because Metro and SafeNest got together and we both had to sort of examine the problems and vulnerabilities that we needed and create a program that was going to work. And it's not been smooth. We've had hiccups along the way. I have had advocates in my office telling me I don't know what I'm doing, and Metro's had the same thing with officers. But we pushed it and pushed it and pushed it because at the end of the day, if we can provide services to a victim when they need them the most, we're going to curb that homicide. Because what happens is victims are made aware of the network of support. And we work closely with Metro in that space, as well as we have 20 plus community partners. So when we go to a scene and it's not a domestic violence victim, which happens occasionally, it might be purely sex trafficking and the pimp is not a relational pimp, we refer that over to Rape Crisis, who has the Great Rise program. We often intersect with kiddos, and we work with St. Jude's Ranch. the community collaboration that can exist in Las Vegas actually can exist at the state level. And one of the things that I pointed to as a down point for us is when Governor Cuomo in New York was doing all of his COVID press conferences. At the end of a lot of his press conferences, he said, if you're in danger, call the statewide domestic violence hotline. When you go to RAG's website, you find 17 different phone numbers. It is a mess, and we have to do this better, not because of any one thing other than it's best for victims. So these are the kinds of efficiencies that we want to push for in terms of a state. How do we get victims the information more seamlessly and more easily? PS 417 could absolutely be expanded statewide with phone advocacy at the scene and lethality assessments. But here's the real power in that. I now can tell you during COVID, our lethality on clients that are calling for services has gone from an 11 on a 25-point scale to a 17 on average. So we know lethality is going up, but we're keeping that homicide rate down low. So I know I've said a lot in that space, but this is what the legislature can do. The legislature can start to get efficient and understand and get behind this movement instead of simply sitting back and saying, yes, we're going to divide up this pot of money amongst everybody and it'll all be great. It's not working. We need efficiencies, but those efficiencies need to come down from the legislature and be pushed in a way that's meaningful for those of us doing this work and for victims.
And Liz, I'm sorry to cut you off there. We're out of time, but it seems like we've got the data behind that for the legislator to be able to take to mind. So very, very important. Liz, Gabriella, Jenna, we thank you so much for your time. Well, thank you for joining us this week on Nevada Week. For any resources that we've discussed on this show, please visit our website at vegaspbs.org/Nevada-week. You can also find us on social media at Nevada Week.